In this video, you will learn how to perform head, face, and neck assessment. The first thing that you will do is to identify the client, provide privacy, and explain the purpose of the procedure.
Hi ma'am, good morning.
Good morning.
I am Christine Cabonegro and I am your nurse for today. May I know your name and your date of birth?
My name is Josie Espinosa. I was born November 26, 1968.
Then how would you like me to call you ma'am?
You can call me by my name, Josie.
Okay ma'am Josie, I am here to conduct an assessment of your head, face, and neck. I am doing this to gather a baseline data and to identify any abnormality if you have so that this can be addressed immediately. So in the course of my assessment, I will be touching some parts of your body. Will that be okay with you?
Yes.
Okay, so before we start with our assessment, I just would like to ask you some questions. Are you having headache or dizziness right now?
No.
Are you having pain?
No.
Do you have any history of injury from fall or motor accident involving your head, your neck, and your face?
None.
Or any surgeries for that matter?
None at all.
Okay, ma'am. So, can we start now with our assessment?
Okay.
Place client in sitting position. Face the client with your head at the same level as the client's head. For inspection, observe the size, shape, contour, and symmetry of the skull. Also note for the consistency, distribution, and color of the hair. Observe scalp in several areas by separating the hair in various locations. Note for presence of lice, nits, dandruff, or lesions. Facing the client, check various facial expressions, contours for symmetry, structure of the face, and movements in relation to eyebrows, eyes, nose, mouth, and ears. Also note for presence of facial skin lesions, edema, masses, and distribution of facial hair.
Mom, can you show me some of your facial expressions? Can you frown? Can you puff your cheeks like this? Okay. Can you smile?
As the client smiles, observe for bilateral nasolabial folds to further assess for symmetry. There should be bilateral nasolabial folds. Inspect the palpebral fissure, which is the distance between the eyelids. The next technique is palpation. Use light palpation of finger pads in a gentle rotary movement, progressing systematically from front to back. Note for head size, shape, symmetry, and presence of masses. Inquire about tenderness upon doing so.
Mom, can you feel any pain while I was doing the procedure?
No.
To assess for nodules, masses, and any depressions, use a gentle rotating motion with the fingertips. Begin at the front and palpate down the midline, then palpate each side of the head. To assess areas of warmth and tenderness, use the palmar or dorsal aspect of the hand to check the relative temperature of the face bilaterally. To check for elasticity, consistency, and pulsations, palpate temporal arteries bilaterally, one at a time. Do not do it simultaneously because it is possible to decrease the blood flow to the brain. Prior to assessment of temporomandibular joint, ask client for history of ear pain and headaches.
Mom, do you have any history of ear pain?
None.
What about headache?
None.
Okay.
To assess for any crepitation, deviations, locking, or tenderness in the temporomandibular joint, place the finger pads of your index and middle fingers in front of the tragus of each ear. The tips of the remaining fingers should drop into the joint spaces as the client opens her mouth.
Mom, can you please open your mouth as wide as possible?
Move the jaw from side to side, protrude, and then retract the jaw. Instruct client to close mouth while you palpate.
Okay, can you please close your mouth, Mom?
To test for range of motion of the temporomandibular joint, place your finger in front of each ear and ask client to open and close mouth slowly. Then move the client's jaw laterally against resistance.
Mom, can you please open your mouth and close it slowly? Okay, close it. And then I will be putting pressure on your jaw. Please resist the pressure.
Test also for cranial nerve number 5, trigeminal, for its motor function. Ask client to clench her teeth or to masticate.
Mom, can you please clench your teeth like this? Can you please chew as if you are eating something? Okay, thank you.
To assess the temporal artery, use the bell of the stethoscope to auscultate for presence of bruit. To test for sensory function of cranial nerve number 5, trigeminal, ask the client to close her eyes and use the sharp and dull side of the pin or paper clip to test sensation on forehead, cheeks, and chin.
Mom, can you please close your eyes? And I will be putting an object to your forehead, cheek, and chin. And then please tell me what sensation can you feel? Okay. Shall we start now? Okay. What about your hands?
Dull. 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 Sharp. Sharp.
Cranial nerve number 7, facial, is tested by checking the client's facial expressions.
Mom, can you please smile? Can you please frown? Can you raise your eyebrows? Can you show your teeth? Can you close your eyes tightly? Mom, can you puff out your cheeks?
As the client is asked to puff out her cheeks, use your finger pads to press the cheeks in. Air should escape equally from both cheeks with this maneuver. Place client on sitting or upright position facing the nurse. And then, observe the side of the neck. Note for skin color, integrity, shape, symmetry, size, lumps or masses. You may use a pen light to shine a light from the side of the neck or across the neck to highlight any swelling.
Mom, can you please turn your head to your right? To your left?
Palpate sternocleidomastoid muscle and trapezius muscle for symmetry, tenderness, swelling, and presence of mass.
Mom, please tell me if you feel any pain.
Yes.
Is there a pain?
No.
When assessing for range of motion of the neck and cervical vertebrae, observe the client for rigidity, pain, and limited movement. To do this, have the client touch chin to chest, to each side, and to each shoulder, then lift the chin towards the ceiling.
Mom, can you please follow me? We'll try to touch our chin towards our chest. Side, side, and then we'll try to touch our ears and our shoulder, and then we will look at the ceiling. Okay, very good. Are there pain?
No.
So, can you feel any limitations of movement?
No.
Using a pen light, inspect the carotid pulses and jugular veins for pulsations and distension. The carotid pulses are best observed in the groove between the trachea and the sternocleidomastoid muscles below the angle of the jaw.
Mom, can you please turn your head towards the right? Okay, on your left.
Using 2 or 3 fingers, palpate the carotid arteries and jugular veins. Palpate firmly but not so hard to avoid occluding the artery. Palpate one side of the neck at a time to prevent carotid sinus reflux. Using the bell of the stethoscope, auscultate carotid pulses for presence of SPUI.
Okay, please turn your head.
To assess the trachea, palpate the sternal notch by placing your fingers in the suprasternal notch and slip it off to each side. Place the thumb and the index finger along one side of the trachea and note the distance between the side of the trachea and the sternocleidomastoid muscle. Repeat on the other side and compare the two distances. Feel the C-rings of the trachea as well. Be careful with palpation because palpating too firmly may trigger coughing and gagging response. To assess the thyroid gland, inspect the client's neck from a neutral position. Lift the client's chin to observe a visible thyroid. Instruct client not to swallow, then instruct to hyperextend neck and to swallow twice.
Can you please hyperextend your neck, Mom? Okay, can you please swallow? Can you do it again? Thank you.
Thyroid assessment is done using the posterior and anterior approach. This is to note the size, shape, consistency, tenderness, and presence of nodules. First, we will demonstrate the anterior approach. Stand in front of the client, then ask the client to flex head slightly forward.
Okay, ma'am, can you please flex your head slightly forward? Okay.
Use the right thumb to displace the trachea to the right. Then place the tips of your index and middle fingers over the trachea and palpate the thyroid isthmus as the client swallows, tilting the head to each side as instructed.
Ma'am, can you please swallow? Can you please tilt your head a little bit? Okay. Can we do it on the other side? Okay. Can you flex your head slightly forward? Okay. Can you tilt your head a little bit? Can you please swallow?
For the posterior approach, stand behind the client. Ask the client to tilt head slightly forward or to lower the chin to the chest and turn the neck slightly sideways.
Mom, can you please lower your chin slightly and then turn to the right?
Place your thumb on the nape of the client's neck and your other fingers around the client's neck, with 2 fingers on each side of the trachea below the cricoid cartilage. Gently walk them down until you reach the top of the thyroid cartilage. Use your left fingers to push the trachea to the right. Then use the right fingers to feel deeply in front of the sternocleidomastoid muscle. Ask the client to swallow at each direction.
Mom, can you please swallow?
Reverse the technique to palpate the lobe of the thyroid.
Can we do it on the other side? Can we lower your chin again and then going to the left side? Can you please swallow, Mom?
If the thyroid gland is enlarged, auscultation should be done using the stethoscope. Use the bell side of the stethoscope. Then ask the client to hold breath while you auscultate. This is to obscure any tracheal breath sounds.
Okay, Mom. Can you please inhale, exhale, inhale, and please hold your breath. Can we do it on the other side? Can you please inhale, exhale, inhale, hold your breath, please.
To assess lymph nodes, ask client to bend the head toward the side being examined to relax the muscles and make the nodes easier to palpate. Palpate simultaneously both sides of the neck, using the pads of the index and middle fingers, noting for the location, mobility, size, shape, consistency, and tenderness. Begin with light pressure, then increasing to moderate pressure. To start palpation, begin at the pre-auricular area. Posterior auricular, submental, submaxillary, submandibular, tonsillar or retropharyngeal, superficial cervical nodes, anterior deep cervical chain, supraclavicular, occipital, and posterior cervical. To test for cranial nerve number 11, spinal accessory, ask the client to move her chin towards her shoulders.
Mom, can you please move your chin towards your right shoulder? On the other side, please.
Then have the client shrug shoulders with or without resistance, and have the client turn to each side against resistance.
Okay, Mom, can you please shrug your shoulder? Okay, I will put pressure and you resist the pressure that I put on your shoulder. Okay, Mom, I will also put my hands on your right cheek and then you resist the pressure. Okay. On the other side.
Ask client to perform flexion, extension, and to touch chin to each shoulder to check for rotation.
Okay, Mom, can you please flex your head? Okay, and then hyperextend. Touch your chin on your right shoulder. On the other side. Okay, Mom, so did you feel any pain?
No,
How are you feeling right now?
I feel good.
Okay, now this ends our assessment. Thank you very much, Mom, for your cooperation.
You're welcome.